questioning. We have 6 minutes for Ms. Lantsman. Ms. Lantsman, the floor is yours.
Thank you, Mr. Chair, and thank you, Mr. Minister, for joining us at committee, and to all of the officials, which we'll get to speak to in the next hour. I know how much work it is, and particularly when you are so busy. I know that a committee appearance showing up puts a lot of people to work. So I'll get right into it with on the questions of mandates. I know, Minister, you talked about this at the very beginning, and I know today Canadians learned, or at least I learned, that you granted some exemptions on the trucker mandate, and I commend you for that. And in your statements over the past months, you continue to claim that vaccine mandates, and particularly the cross-border ones, are based in science, are being implemented to protect Canadians. So I just wanted to know if you're able to provide the committee with any study or data that you're confidently basing these statements on.
Thank you, Mr. Chair, and to my colleague, I want to first congratulate her. I've done that privately, but I want to do it publicly on her appointment as a transportation critic, and I'm looking forward to continuing to work with her and her colleagues. Mr. Chair, vaccines save lives. And I wasn't honestly expecting to get a question to provide evidence to that, but I'd be more than happy to provide evidence that vaccines save lives.
Mr. Minister, I'm going to interrupt for 1 second. It's not, the question is not about whether vaccines save lives. It's just, what data are you using to implement the cross-border trucking mandate? We know that vaccines save lives. Just what is the positivity rate? Maybe I make this easier for you. What is the positivity rate before the mandate, and maybe the positivity rate after, so we know whether it's working?
Great. I'm happy to answer that question. And if you agree with me that vaccines save lives, then I'm sure you agree with me that you want to save the lives of truckers and transportation workers. I'm sure you agree with me that you want to reduce hospitalization rates among truck drivers and other transportation workers. I'm sure you agree with me that the lower the infection rates and hospitalization rates and death rates among truckers and other transportation workers will be good for our supply chains, will be good for our economy. So again, if the evidence is available and persuasive that vaccines save life and reduce hospitalization, this is all the evidence that all of us need to support.
Okay, so I'm just gonna. I know that my time is limited. So the department is making decisions not based on any studies, but general hospital rates. I want to know, Mr. You talked a little bit about in the past that regulations were being created, or mandate was being created on cross-country interprovincial trucking mandate. Can you tell me what day those will be announced?
Mr. Chair, thank you for that question. Again, vaccines save lives, and what we have said is that we are studying the formulation of regulations for all federally regulated sectors. And right now, there's consultations ongoing with all sectors. I'm unable to give anybody a date yet because the consultations are ongoing.
So I understand that I understand that the pandemic is dynamic, but is there any scenario planning about when restrictions might be lifted, or what the appropriate thresholds are? I just want to know whether these restrictions are actually being studied based on data, or frankly, the notion that vaccines save lives, which I think we all agree with, or is it public opinion?
Mr. Chair, we've said from the beginning, our public health measures are derived based on science and data, and they're done to protect the health and safety of Canadians, but they're also done to protect our economy. We've also said that these measures are temporary, and we have all the willingness to continue to adjust them as the public health situation changes. And we've demonstrated that in the past, and we have demonstrated that this week. So yes, I can't wait for all of these measures to be lifted, but it's also responsible of me to tell Canadians that we don't know when these measures will be lifted. They'll be lifted when the time is right and when our public health experts tell us that it's safe to do so.
Thanks, Mr. Chair. I actually just want to move to travel restrictions. What I'm trying to get at is I'm trying to see if the committee can access any of the data by which you are making decisions on, or which you are claimed to be making decisions on. So I just wanted to know the advice that you received on travel recommendations. My understanding is that the experts within that your own government listens to, in the last set of restrictions, the recommendation was a level 2 travel advisory, but you implemented a level 3 travel advisory. Is that true?
Mr. Chair, maybe my honourable member, let me remind Canadians and everyone else who's watching us. 2 months ago, we were at the height, or almost 3 months ago now, we were at the height or at the beginning of the Omicron wave. We have just discovered, and scientists around the world were alerting us to this new variant that is highly transmissible. And there was a lot of other information that was still missing about Omicron and the impact that it'll have on public health. I remember Conservatives colleagues in the House of Commons demanding stricter border measures to manage the arrival of Omicron to Canada. And what we did then, we imposed additional strict measures to purely protect the health and safety of Canadians, to slow down the importation of Omicron, but to also advise Canadians about the risk associated with traveling internationally when this new variant is spreading everywhere and carrying a lot of unpredictability with it.
Thank you very much, Ms. Lantsman. Thank you, Minister. Next round of